Hi friends, in this video we will talk about how to read normal chest x-ray. So this video is mainly aimed towards MBBS students. This is a basic level video because no one can tell how to read a chest x-ray in 1 or 2 minutes because it requires too much very good discussion. So we cannot just tell in 2 minutes. So but basically you all know air appears black in the x-ray. So this is the reason why we are seeing lungs as black shadows and ribs as white shadows. So whenever if there is any pathology, like it can be any pus, infection, any fluid in the chest, so then the black thing is replaced by a whitish color anamata in the x-ray. So if there is some consolidation or if there is some ground glass opacities, for example, patients affected with COVID and all, the normal blackish structure of the texture of the lung is replaced by a whitish thing. So, and one more thing, what we need to observe is these two markings. This is the costophrenic angle. This is the cardiophrenic angle. This is the cardiophrenic angle and this is the costophrenic angle. These normal angles should be maintained. If there is any obliteration, then we need to suspect some pathology. And this is the normal gas bubble in the stomach. You need not worry about that. It is a normal thing. And one more thing what you need to see is whether there are any fractures in the clavicle or in the shoulder joint, whatever you see. Okay. Sometimes minor hairline rib fractures can be missed, but if the patient has got chest pain, difficulty in breathing, any history of trauma, always better advice for a CT scan of the chest. So we need to see for the bronchiovascular markings as well. So these are the normal bronchiovascular markings. If there is any chest, if there is any infection, mild infection and all, these the bronchiovascular markings will be more prominent. And we need to see for the cardiothoracic ratio as well to know whether it's cardiomegaly or not. So you need to measure the distance between this point A to point B. This is the heart measurement, and you need to measure the thoracic from this end to this end. So cardiac by thoracic, it should be less than 0.55. If it is more than 0.55, it is a cardiomegaly. So to summarize, basically we need to see for uniform blackish shadows, and you need to see for the costophrenic and cardiophrenic angles, whether it's maintained or obliterated. You should see for the normal, this bubble is normal, you need not worry about that. If it's a trauma case, you should check for any fractures. Sometimes there can be fracture of the clavicle, sometimes there can be fracture of the ribs and all. So these are the basic things what you need to observe in the chest x-ray. I hope this video is helpful to you. Thanks for watching. Bye bye.